So I was asked a question about chiropractic and women's health, and how that plays a role. And that's a very, very broad category, and there's a lot we can say upon it. But let's just talk about a few things that women struggle with that are definitely spinal related. So when it comes to women's health, we often think about women's periods or their menstrual cycle. And the big problems with that are obviously pain, discomfort with the periods, and irregularity or lack thereof, or too much. All of those I've seen in my career can result from spinal nerve irritation. So I've had a woman who had so frequent periods that she was really getting almost too low in blood, passing out because her body was what they call hypovolemic. It didn't have enough blood. She had a continuous flow of blood. I've actually had two of those cases, that I remember vividly, and both of them end up being a bad spot in their lower lumbar spine. I've also had women that have had periods in over a decade and were able to get their periods back. And once again, just because it was nerve pressure in a different part of the spine. When it comes to pain with menstrual cycles, menstrual cycles don't have to be painful. My personal story, my wife used to have painful periods before we got married, and then once I started taking care of her, that all went away. So she doesn't have painful periods. Just like a lot of the uncomfortable stuff when a woman's pregnant. Pregnancy is, if there's one time in life when women should definitely be under care, it's when they're pregnant, because the spine goes through so many biomechanical changes because of the way the baby's drawing the spine forward, that oftentimes a lot of damage that's not causing symptoms at the time will become symptomatic just because of the new stress that's placed upon it. And also, conversely, when a woman gives birth, some of the reasons why a woman has to have cesarean are spinal related as well. Because if the pelvis is stuck, the pelvis can't open up and the baby can't go through, because there's not enough space in a normal woman's pelvis for any baby to go through normally. What happens is a hormone is released at the end of pregnancy called relaxin, and what that does is softens up what's called the pubis symphysis, which is in the front of the woman's abdomen, so that the pelvis can kind of go from like this to like this. And that's what allows enough room for the baby to go through. But if a sacroiliac joint is fixated and can't move, essentially, that will prevent the pelvis from opening up, and that alone can cause labor to stall out, which if it stalls out, they're going to emergency C-section. Also, the inability to conceive. That can be from a lot of things. Like I said, lack of ovulation, I've seen that. If a woman miscarries all the time, that can be because of the way the pelvis is tilted. If the pelvis is tilted incorrectly, makes the uterus fall and sit at a weird angle, which can prevent the woman be able to carry a pregnancy very long. So there's a lot of factors you have to look into with that. But all I can say with over 20 years of experience is I've seen just about every form of problem like that respond at some point. Doesn't mean every woman's problem is going to respond from chiropractic, but it's a good place to start because it's not invasive, it's safe, and it gets to the root cause of why you have it. So I would start there with a lot of those issues, and then obviously work with your OB/GYN, who you have to realize a lot of the medical community isn't on board with us because they really don't understand what real chiropractic is. They just kind of base their thoughts upon what a majority of our profession does, which is randomly manipulate the spine, which really isn't chiropractic at all. But when it's done right, it would be nice if we could work together, because all they can do is treat the symptoms, and they're doing their best for the women that they can, but they don't have enough tools in their toolbox to really get to the root cause. So while they're going to do their best, and they can help women with fertility issues by IVF and stuff, I've had women go through IVF so many times and spend so much money that still couldn't get pregnant simply because of spinal issues. So start with good chiropractic care. Other than that, there's other things that women deal with, hormonal swings and stuff that sometimes can be helped, but that's very complex, and you need to do probably work with your OB/GYN on that as well. So I hope that helps, but there's a lot we can do for women and women's health.